welcome to today's mental point check. I'll be yours, Eric Magabi, as we are going to talk about mental health milestones. So, Kenya is on the rise about mental illness, like patients are becoming more and more each day. Many people are suffering of mental, be it of stress, be it of lack of work. So this creates like pressure to everybody, and so they find themselves in one or another way becoming victims of stress. So what's tragic is that stress is not only associated with those who are rich, but neither is it also associated with only those who are poor. Neither can we say that Kenya is the only sufferer of this threat of mental illness, but all countries are to be considered as developing as far as the mental illness is concerned. So what then pushes us to say that all countries are to be considered as sufferers of mental illness? What we mean is, despite a given country has everything that it takes or it requires, they still need to do more about in their medical treatment for the mental illness patients. For instance, in Kenya, mental illness is to be considered associated with the spirits, or rather punishments from the ancestors or gods. So, but today, welcome to our nicely prepared topic about mental health milestones. First, we like to begin with a sense of mastery over the environment. So, this is the ability of oneself, emphasizing the ability to choose or change the surrounding using the physical or mental actions, as well as being able to control the events or the personal feelings towards the environment. This means the ability of one to be able to cope up with the situations, whichever, like whenever it changes the environment, and accepting it the way it is, so that that this is what we refer to the mastery of the environment. Secondly, we look at the milestone of sense of autonomy, the mastery of the sense of autonomy. This is the immediate person ability to act on his or her own values and interests, to act on his or her own interest. Simply, this is Kate Blank. Yeah, Kate Blank. Thirdly, we are going to talk about self-realization in the pyramid of hierarchy of needs. As Maslow says, needs of humans, it's an expression or a fulfillment by oneself of the possibilities of one's character or personality. And under personality, we really need to understand the personalities of the people surrounding us in the community, given that whenever a specialist is handling a patient with mental illness, he really has to understand the patient, be it how to engage him or her, so that to understand better how to help her. So the community is also the community surrounding the patient, or us surrounding us as patients, sees that being that we all are sufferers of stress. So we need to understand each other as far as mental illness is concerned. So Maslow in his pyramid defines as mental illness may arise for so mental illness may arise if really the pyramid of Maslow is not taken into consideration. What I mean is that the family does not give the attention, the love, according to how the Maslow's pyramid stipulates. Self-realization is the liberation of knowledge of the true self, either as a permanent undying witnessing of consciousness, which is of such a permanent self. Over the last decade, my community, Kenya, has seen one crisis after another: job loss, foreclosures, and financial impact on the Great Recession to the turmoil of racially charged events leading up to the Black Lives Matter movement in Kenya, to the onset of the global pandemic of mental illness that has to date resulted to many deaths in Kenya, thus not even factoring in significant political divisiveness and national tensions, or murder hornets for that matter. What I mean is that in Kenya, times of crisis can cause even normally healthy and well adjusted people to experience mental health concerns. And for those already suffering from anxiety, depression, or other mental health disorders, it can be much worse. If one good thing has come out of all these crises stacks on one on to of another, it's that if we've had the opportunity to shine a spotlight on mental health, raising awareness, combating age-old stigmas, and making mental health resources more available to those who need them. Because it's like, however a country is more developed, however, however it has got all the facilities, it's like they still have to really visit those who are suffering from mental illness, despite the fact that they've got everything in the hospital, they've got the specialists. No wonder it's it's the rich that most suffer for in cases of mental illness, as Vikram Patel says. Yes, it's because they assume that it's a normal thing that and it will pass away. Now, back to Kenya. The cost of healthcare in Kenya is enough to cause anxiety. Yes, even in those with a relatively good insurance coverage. For the millions who go without health insurance, it is even worse, as they have to weigh the consequences of failure to treat illness and injury against the potentially outrageous cost of seeking treatment. Also in Kenya, controversial practices like charging more or denying coverage to those with pre-existing conditions are rampant, creating a list of non-essential health benefits that should not be included in plans. All this list prioritize women and children's health services that are not even considered essential, and adding risks on mental health and substance use disorder services, including treatment options like counseling and psychology or counseling and psychotherapy. This is a huge benefit for those coping with the mental health concerns, and a step in the right direction for mental health awareness and treatment is always a need for Kenya. Thank you.